We also want to let everybody know that this session will be recorded. So if you have any colleagues or yourself want to refer back to the session, it will be up on our website a few days after this.
Hello, everyone. Welcome and thank you for joining us today to discuss the Canadian Quality and Patient Safety Framework. We'll be starting with the slide deck and starting with the recording of this session. Welcome again, and thank you so much for joining us. I'm Amy Pack, Senior Program Manager, leading the development of the framework. Before we kick things off, I'd like to introduce our wonderful moderator. I want to point out the Q&A box and the chat box in the right side of this screen. Please feel free to use it throughout the presentation. We'll be monitoring it closely and answering any questions and comments you share through that box. Let's get started now. We're excited to launch the framework and would love to introduce and welcome our first moderator, Leslie Thompson, CEO of Health Standards Organization and global champion of this work. Leslie, please feel free to take it away.
I'm navigating all the new unmute buttons, but I want to say thank you and welcome to everybody. We have a very exciting kind of a panel presentation for all of you today, and we are delighted to be here together launching the Canadian Quality and Patient Safety Framework for Health Services. And we've got an incredible group of speakers and people who have been major contributors to this, and absolutely delighted to be part of this today. What we wanted to do first is set the stage for why we're talking about the Canadian Quality and Patient Safety Framework. And we all know that the quality and safety of healthcare is top of mind, and probably never more so than during this pandemic and during this very, very challenging time. It is not a new challenge, but I think the current situation has certainly amplified the need for us to zero in on key areas of attention that are required and mobilize our collective efforts together to be speaking a common language, to be coming together in ways that can help us zero in on the most important priorities that have actually been agreed to and informed by extensive evidence, consultations, and consensus building with leaders like all of you from across this country, and including, most importantly, the voice of patients and families and those who are the ultimate beneficiaries of the framework. We know by having a common vision from the experience of other countries and jurisdictions, that a common vision, a common language, and common areas of focus to mobilize our actions around impact outcomes, that approach can make a big difference. Canada is in fact one of the very few countries in the world that until now has not had a common framework for quality and patient safety. And so we are absolutely delighted to be able to launch today this framework. It has come from almost 2 years of work with a very distinguished and incredibly passionate, talented committee of advisors from across the country, representing policymakers, academics, health delivery leaders, as well as patients and families. And together, we've forged an alignment across the Canadian Patient Safety Institute and Health Standards Organization and Accreditation Canada to have this work inform our priorities, as well as provide tools and resources for all of you to be bringing this framework to life. Today, you're going to be hearing about key features of the program or of the framework, hearing about ways to actually make it real. No matter where you work in the system, the framework is being designed to be actionable for policymakers, providers, patients, and families, and that together this will help us move forward and make more measurable progress on key outcomes that need to be achieved. We are delighted also through the work with Jennifer, Zellmer, and myself leading with our teams. We've met with the Council of Deputy Ministers across Canada to socialize them to the framework, to bring them their awareness and talk to them about ways in which they can actually use this. And we are absolutely delighted to announce today that our Health Minister, Patty Hughes, has endorsed the new framework for health services publicly and acknowledged the importance of the framework to help us channel our efforts in order to make the difference that we know we all need to advance the meaningful change that will improve quality of patient safety across Canada and provide leadership to others around the world. So stay tuned for an exciting hour, and I will be back toward the end to help wrap up and talk to you about where we go from here. Thank you, Amy.
Thanks so much, Leslie. And I believe we will just take a minute as well to acknowledge at the beginning of the webinar that I'm personally joining from the traditional unceded territory of the Algonquin Anishinaabeg peoples, and recognize that there are many of us who are joining from lands across the country that have been walked by Indigenous peoples since the beginning. And as I've learned more about the traditions of the people who, the Algonquin Anishinaabeg peoples, one of the things that I've learned is about the importance of this place as a gathering place and as a place of exchanging knowledge and learnings and teachings. So wherever you are in the world, obviously the virtual environment provides us the opportunity to connect. And I've already seen messages from people right around the world on the webinar today. Please feel welcome and so glad that you could join us. And now I believe we're going to do an overview of the framework to give everyone a starting point, make sure we've got a common grounding, and then we will have a wonderful conversation with our panel for today about how the framework is being used and opportunities going forward. So I'll turn it back for the overview of the framework.
Hello, everyone. So what are we setting out to do? People in Canada truly deserve and expect safe, high-quality health services and has many strengths to achieve higher performance in global quality safety rankings in Canada. So what is the purpose of this framework? Truly to align Canada on quality and patient safety, following 5 overarching goals. The 5 goals are focused on people-centered care, safe care, accessible care, appropriate care, and integrated care. And it's truly time that we take action together. The framework includes multiple implementation sections that are instrumental in truly actioning the overarching principles of these 5 goals. So it includes action guides for 5 key stakeholder categories throughout our healthcare system. The first action guide is specific for members of the public, and then we outline actions for healthcare teams, which include the instrumental role of patients and family members. We also have action guides for healthcare leaders, healthcare board members, as well as policymakers to really have a well-rounded coverage of quality and patient safety improvement throughout our healthcare system. We have a list of resources that are instrumental in putting into action these suggested interventions so that we can see the action in our day-to-day activities starting today even. An example of this is one action for the members of the public to participate within the review and development of standards. If we want to roll in that, well, we can click on Health Standards Organization webpage and see the offering of standards that are currently up for public review and identifying what standards are of interest to you and how you can read through these draft standards and provide your instrumental feedback. So we'll click the resource and you can easily action these interventions starting today. We also have clear indicators that help you track your success in your journey in improving quality and patient safety. This is a very actionable section that can be used by organizations, by policymakers, by the healthcare system at large. And they have suggested data sources so that can be actionable within your own jurisdiction, your own context, because we recognize that these contexts are variable throughout Canada. Now, I'm pleased to pass the baton back to Leslie and Jennifer to begin our discussion today, because that's the whole point of today's webinar, really to understand how this framework is being actionable within Canada already. Even understanding that this week was the first week of the launch, we're already seeing concrete implementation of this framework, and I'm excited to hear more about how it's being used. Thank you, Leslie and Jennifer.
Thanks so much, Amy. Really appreciate it. And I realized I did a bad job. I didn't actually say who I was. So I'm Jennifer Zellmer. I'm the President and CEO of the newly amalgamated organization that brings together the Canadian Patient Safety Institute and the Canadian Foundation for Healthcare Improvement. And I was super fortunate in my previous role to be a member of the advisory group who provided some advice on this, and want to thank all of my colleagues who sat around the table for the hard work that was done, and huge shout out as well to the teams of staff who've been involved in developing the framework. And want to transition now, as Amy said, to our panel discussion about the use of the framework today. So we've got panelists from right across the country with different perspectives and different contexts. And we're going to start off by just giving them an opportunity to talk about what the framework means for them and how they're starting to think about using it. And I will remind each of my colleagues on the panel to don't follow my example, but do the right thing and introduce yourself at the beginning of your remarks. So Linda, can we start with you?
Sure. Thank you, everybody. I am Linda, not Wayne. Somehow the computer wants me to be Wayne today, and I'm sure that he'd be happy that his name is up here. But anyway, I'm Linda Hughes. I'm a former co-chair of Patients for Patient Safety Canada and a member of Patients for Patient Safety Canada. I'm so happy to be here today because I was one of the patients that was involved in the development of this framework. It was just a wonderful experience to be involved in. And so at about the same time as all the work was happening on the framework and we were getting it to the end stages, Patients for Patient Safety Canada also undertook a major initiative, which was to have roundtables on patient safety with ministries across the country. And we were focusing on 3 policy requests that had come up through from our members. And those requests just really highlight points from the framework itself. So we met with, I believe, Manitoba, Newfoundland, Nova Scotia, Prince Edward Island, Alberta, and Ontario, with the health ministers and their staff, along with patients from those provinces. And we had a really, really good discussion around the policy requests that we had in regard to safety. And one of the really important things that we could do even then when we were having these meetings, and they are continuing because we, of course, haven't finished all of our meetings, is that we could use the same language as already was in the framework. So I want to just give you a couple of examples. I don't know if you can put it up on the screen there for me, Haley, but for example, in the framework, goal number 1 is people-centered care. People using health services are equal partners in planning, developing, and monitoring care to make sure it meets their needs and to achieve the best outcomes. And then an objective under that goal was all aspects of care are co-designed with patients and providers, and that there are formal and informal patient partnerships established and consistently supported at all levels is the outcome. So that fits very nicely with one of the requests that we made to those 6 provinces, and that was that, in fact, Patients for Patient Safety Canada and local patient partners should be invited to be part of ongoing provincial and territorial initiatives aimed at the above and making care safer. So another example, if you look at Goal 2, which is safe care. Health services are safe and free from preventable harm, and the first objective is that there is a safety culture evident across the continuum of health services, and that patients, providers, and leaders are encouraged and supported to report and act on patient safety concerns and incidents. Well, our first request to the ministers was, in fact, right along those lines, asking that there were systems in place so that all people are encouraged, families, providers, and patients, and are supported and feel safe to report patient safety concerns and incidents in real time. And the system should include resources for follow-up and reporting back, and that reports are shared to improve the safety of care. One more example that I'd like to give is still associated with Goal 2, safe care, and the safety culture, are these outcomes, 2.1.2, which are that patient harm events are disclosed to the patient and the family as soon as known and documented, that patient safety events are analyzed and acted upon by interdisciplinary teams, which include patients, and patients who are harmed to have access to psychological support programs. Now, our request fell under a request about preventing further harm, and they exactly mirror what's in the framework. A patient who has been harmed is informed as soon as it is known. The harmed patient, if they wish, members of their family are included in the investigation and in ongoing communication and about improvements aimed at preventing further harm. Support such as counseling and assistance navigating the healthcare system, financial resources, etc., are in place and offered. And that the patient, other than the person harmed, should be included as a member of the safety investigation team. So the beauty of this is the consistency and using the same language, which really, really contributes to, in fact, a good dialogue and a good discussion when we're all using the same language and talking the same. So I think that's a good example of how we've already started to use the framework. So thanks, Jennifer.
Thanks so much, Linda. And so important that you highlighted how not only have patients been involved in the development of the framework all the way along, but this is a tool for all of us. And it's an opportunity for all of us to leverage these resources, this language that's collective, and these opportunities that you said. Valerie, I'm wondering if I can turn it over to you now for your perspective on the goals in the framework and how they're relevant in your environment, how you're starting to think about it.
Well, thank you very much. So my name is Valerie Gideon. I'm the Associate Deputy Minister at Indigenous Services Canada. which has a major responsibility for primary health care and public health across First Nations communities in Canada, as well as establishing strong partnerships with Inuit and Métis communities in the area of health. I'm Mi'kmaq from the Gaspé First Nation in the Quebec region, and I've spent my entire career advocating for better outcomes for Indigenous peoples across Canada in various roles. The reason that I participated in the development of this framework is, well, there are multiple reasons, but I would say that, I'm hoping that the framework can be broadly adopted and applied across federal, provincial, and territorial health systems at all levels, at a community level, at a health authority level, and a broad-based health system level, in order to really ensure that there is more inclusivity. I think that Linda spoke very eloquently to the importance of engaging patients. And I would say the same is true with respect to including Indigenous nations, Indigenous individuals, Indigenous health providers, Indigenous medical students, nursing students, midwives, and so forth, that have too often been marginalized in the Canadian health system, and where their traditional approaches, practices, languages, cultures have not been valued or brought into the discussion with respect to health services. Within our department, we still have a long way to go with respect to adopting patient safety and quality approaches. And, an example is in the area of accreditation, where we only have 30% of First Nations community health centers that have had the opportunity to be accredited. And the reason that I use the word opportunity is because it is resource dependent and funding dependent. It is not because of a lack of interest. There is a significant demand from communities who want to be able to celebrate the quality of health services that they are offering and have that recognition, as well as that peer and professional support to be able to monitor and measure their service improvements. We saw during the COVID-19 pandemic, we surveyed the accredited health centers and some nursing stations and found that close to 85% could attribute a difference that was made in the context of accreditation in terms of their capacity to effectively respond to the COVID-19 pandemic. And the results are very stable with that 85% threshold in a number of to infection prevention and control, emergency preparedness and pandemic response, and decision-making and planning very specifically. So we see a huge growth opportunity with respect to applying the framework in terms of advancing and spurring more resources to support accreditation, but also in the area of people-centered care. So we have with respect to the services that we directly deliver in communities, and we are aligning that process to this framework as well. We also have established a nursing services response center. And of course, we employ close to 700 nurses that are really providing frontline services across the department. And we also, of course, as many of you do draw from other sources of surge capacity, those are required, such as nursing agency resources. But our Nursing Services Response Center offers more specialized expertise and training for frontline nurses. We actually did a nursing workforce survey over the past year and found that most nurses really do not feel that they are properly supported with respect to tools and technologies that enable them to really deliver quality care. And they do feel that an absence of these resources is impacting patient safety and the quality of their work. And so those types of support programs are extremely important. We've also introduced a nursing resiliency wellness program as well, so that we can truly support or better support frontline providers with the challenges that they're experiencing. Accessible care. So we've all seen during the context of the pandemic a growing momentum with respect to virtual healthcare. We actually fund about 260 telehealth sites, some of them in the most remote communities in Canada. And just in 1920, we sponsored about 18,000 telehealth sessions that have taken place with respect to patients in First Nations communities and their providers. But there is a critical importance in ensuring that we are monitoring patient safety and quality in the context of virtual care, particularly as it grows very, very quickly across Canada. So I do see the framework as extremely important in that regard. I will speak later on in the webinar about the critical importance of appropriate care and with respect to cultural safety and anti-racism. So I will not do that now, but I hope I've been able to give you a couple of concrete examples of where the framework can apply in the context of Indigenous health.
Thanks so much, Valerie, and super helpful to have those tangible examples that tie the goals of the framework with the work that you're doing, and as you said, the opportunity to collectively both celebrate quality and also to mutually learn and continue to improve, because all of us want that continuous improvement as we go forward as well. Michelina, we're moving from west to east today, so can I bring you into the conversation?
Yes, hi, thank you. So I'm Michelina Mancuso, and actually I am wearing a bit of two hats here because I'm a recently retired Executive Director of the Performance Measurement for the New Brunswick Health Council. And my alignment with the framework was there because I truly believed in all the elements of the goals in terms of what could be required in order to actually improve the quality and safety and what was actually things that could be put in place. And because of being retired, I'm currently now on a short-term contract as a facility coordinator for pandemic screening, actually at a Moncton Hospital, Sackville Hospital facility as part of the Horizon Health Network. So my perspective here actually about the framework is actually from an on-the-ground perspective to see the applicability of the framework, because the organization had actually been one of the early adopters in actually believing in the framework and already aligning many of their efforts with the framework. So I thought I would just take a quick opportunity and give you a couple of examples of how the framework is actually being applied on the ground. With health services. So upon my arrival in June, we were seeing through the screening process at least 20 or 30 incidences a day that were happening. And we were getting about 1,000 to 1,400 entries of patients and visitors. So this is a really interesting opportunity to see what was going on. And we were seeing really quickly the lack of navigation or patients getting lost. Many arriving without support. During the process, the risk for fall, all the diverse populations, the communication needs, all the different things that were present as issues, but were magnified when you're having to all see them and entering them in the front door at the same time. And it presented an actual opportunity, which was incredible to see how the framework actually was able to help improve these in a quick way. And here were these examples of the enablers that happened. The issues that we were seeing on the ground were quickly being relayed to the managers and directors. And these groups were actually meeting as emergency operations on a regular basis. So what was happening is they were able to institute very quick virtual meetings to actually start to address these issues because they wanted to improve and apply the framework. And here was the interesting part is that all the health team members, the screeners, the porters, the admitting clerks, the communication information, the physical resources, the outpatient department, security, housekeeping, even volunteer services, all of them actually started to realize that they were all involved in all of these incidences and how to improve the process while providing the safe and effective care that they're actually trying to accomplish with these individuals. And what happened was that the groups were able to create the changes very quickly using their own input. And the guide for all the different groups had their voices within this process to actually create the change. And what was even more interesting is that because you were getting regular patients and visitors that were actually coming through the doors, as the changes were being implemented, they were actually able to comment and suggest the improvements, which then created the continuation of the quality improvement process. And this led quickly to what we call the a wayfinder position, which helped in this whole process. But we were starting with 20 or 30, like I said, incidences per day on issues that were related to the different safety. And now it's been reduced to less than 10 different incidences in a week. And so the whole point is that everybody had different roles to play, but it came from the quick responsiveness, the policy, the leaders, and all of that together aligning with the framework.
Thanks so much, Michelina. And first of all, let's just take a minute to celebrate the improvements in safety and quality that represents in an incredibly challenging time. And, you know, in that context, I think maybe that helps us to turn the corner because while this is safety and quality have been important for a long time in the health sector, will continue to be important for a long time. I think right now we're seeing the world through our current lens. And boy, this has been a complicated year with lots of, you know, the pandemic has been referenced, but also, you know, shining a light on issues around anti-racism in the health sector, shining a light on other issues that we're facing right now. So I'd love to continue our conversation talking about how some of those kinds of issues are reflected in the framework and how that may be useful. And just before I turn to Valerie to start us off with that conversation, because she teased us with saying she was going to come back to some comments earlier, just also invite everyone who's on the line, if you have thoughts, suggestions, questions, feel free to type them into the chat so we can also continue to broaden the conversation with the whole group. But Valerie, over to you for 2020 and where we are today.
Well, thank you very much for this opportunity. You know, throughout the pandemic, and of course, much prior to the pandemic, but even in the course of the pandemic, I had the opportunity to speak regularly to frontline health providers, doctors, Indigenous doctors, principally, and specialists, and they were seeing increasing cases of racism against their patients, difficulty accessing services in the context of the pandemic. And it really struck them, as it struck me, that this is something that has become, quite unfortunately, very normalized across Canadian society. And then Joyce Eshkon's video, live feed on Facebook, was an incredible tragedy, a horrible circumstance. And I do think it did shock many people. Unfortunately, it didn't shock those of us that have heard about these stories for far too long. On October the 16th, several federal ministers hosted an emergency meeting on the issue of racism against Indigenous people in Canadian healthcare systems and heard firsthand the lived experiences of First Nations, Inuit, and Métis health providers. I mean, heart surgeon specialists, nutritionists who have become doctors, nurses that have become doctors, nurses, midwives. And their experiences of racism go back to, of course, their childhood, their youth, but also as medical students or nursing students throughout their entire career until today. It has been a consistent thread and source of suffering that they have endured. And it has affected, of course, the quality of the services also that their patients have received, which I think actually hurts them more than any of their own personal and professional experiences. So the country has to confront this, obviously, all of us that are implicated in some way in supporting health services within Canada have a role to play. It's not about a blame and shame game here. But I think if we are introducing a Canadian patient safety and quality framework, this is an issue that can only benefit from that framework being hopefully adopted and promoted. But of course, we do need to work on more detailed tools and strategies and action plans to complement the framework to address an issue of that degree of significance. Thankfully, the British Columbia First Nations Health Authority, which manages all of the First Nations health services across all of the many communities of British Columbia, over 200, had started in 2017, actually, an effort to work with the Health Services Organization and actually develop a cultural safety and humility standard. And that they have been mandated by the Assembly of First Nations Chiefs Committee on Health, actually, to host that effort. And they are also reaching out to other Indigenous peoples to ensure that the standard will be reflective of the various distinctions-based perspectives. But I think that that will be an incredible achievement. And I look forward to that standard also being adopted across Canadian healthcare systems. So I'll just wrap up by saying we are planning a big, broad meeting in January of 2021, which will invite representatives from across the Canadian healthcare systems, professional associations, schools, post-secondary education, Accreditation Canada, the Health Services Organization, and members of this committee to really present their ideas and their concrete action plans for how we can address racism in Canada's healthcare system. So with that, I'll turn it back over to you, Jennifer.
Thanks so much, Valerie. And just a couple of things maybe to highlight from your remarks. One, the real importance of embedding our collective work in this area throughout all the dimensions of what we do. And also the fact that this is a living framework. This is a living set of tools and resources that we need to continue to nurture and grow, and as new resources, as new standards are developed, to make sure that we're linking things together as well so that we can continue to move forward together in that way. Thank you. Michelina, you also talked about sort of the challenges of 2020 and sort of how you're seeing the framework in the particular environment of the pandemic, but I know you've got other thoughts as well more broadly. So I don't know if you want to jump back in.
Yeah, thank you. So I really, truly believe that the framework has the potential to speed up the culture of safety while dealing with some long-standing challenges that needed to be effectively dealt with in order to move the quality and patient safety of health services. The first was mainly around highlighting that sometimes the disconnect between the different policymakers. I look at the regional health authorities versus public health versus government, and issues just as simple as mask wearing exemptions or allowing support people for criteria, the inconsistency in the training, the consistent message, the communication, the rollout. A lot of these disconnects was creating confusion for patients, for public, for families. And this is where the opportunity of the framework in 2020 to be able to support that could really, really help understand that. The other thing were even things like decisions for change. A lot of policy-making decisions were being done on a Friday, for example, late in the day, where a lot of the implications of creating these complex changes and managing these things on the ground was very difficult when you're making those decisions and then trying to implement stopping visiting or creating how are you going to communicate with the impact of what's going to happen when on the ground you have to mobilize thousands of people within a few hours, and the disconnect between a decision and then on the ground, and then how it affects the safety, how it affected the patient-centered care, the visitors, the individuals on the front line that had to quickly figure out how to handle all of that. It was absolutely brutal sometimes to, at 5 to 2, holding people back for a decision to say, you cannot enter in 10 minutes and you have 200 people standing outside the door. And what happens to those who were 95-year-olds visiting their loved one that cannot do that anymore? And the staff was not prepared necessarily to provide the information, the social isolation, the virtual, not having enough tools ready for that impact. Those are some of the things that definitely affected the care, the safety, and I think those are learnings that we have to deal with if we're going to continue this in future to change the culture of safety.
Thanks, Nicola. That's an important example, and there was a quote that have come in on this front around how intentional here is not to replace all of what we're doing. It's a common language, a common way of being able to say, oh, we're talking about this thing over here, and to collect resources that may be collectively available in a way that we can all access them and make available. And Linda, I know that's something that you care deeply about as well, and you've also had many conversations with colleagues I know in Patients for Patient Safety Canada about the specific impact in 2020 and all of the various challenges that we're facing more broadly. Did you want to come into this conversation as well?
Sure. Thank you, Jennifer. And maybe you could put up that next slide, Haley. What I wanted to talk a little bit about is some work that was done when we first ran into the pandemic in the spring, and looking at the framework strengths, the framework was developed before we knew anything about the pandemic. And then we looked at what the Pan-Canadian safety priorities were because of some of the things that we were facing. And if you look at the relevance of the framework strengths in regard to the Pan-Canadian safety priorities, it really points out, at least to me and I hope to everybody, how relevant the framework is now and will be in the future, regardless of what we face. So I think this is a very good example. I'm not going to run over each one of them, but you can see if you take a quick look at it, and I'm sure we're going to share the slides afterwards with everybody, that there definitely is true relevance with the framework in regard to the current pandemic we're facing and probably many, many other things going forward. So I just thought that was a really important thing to point out, Jennifer. And I do want to just acknowledge Sandy Cozy, who had contributed to this content. So thank you.
Thanks so much, Linda. And that's maybe a good segue as well into one of the questions that was asked in the chat that was specifically about, so who are the people in people-centered care? Because we live in unique and diverse contexts, and particularly relevant also for the goals of appropriate care, looking at the systemic and systematic learning initiatives that may be required to really live the values that are represented and the goals that are represented. And so a question about, is the health and medical education system keeping up with these changes and a focus on people-centered care? So I'll look to the panelists in terms of, you can wave at me, with your arms if you want to answer the question. But maybe Linda, given that you were just talking about this topic, I'll start with you. So both from a health and a medical education point of view, are we keeping up with the goal of people-centered care and the diverse perspectives that requires?
Well, I think we've always got room to grow. Talking about education, I haven't been involved in it for a few years, but when I was in nursing education, the curriculum was very person-centered, and I think that's true of probably most healthcare professional education programs across the country. The difficulty is sometimes when you get into the real world and you have the pressures that happen in the actual setting where you're taking care of people, I'll call it frontline, sometimes you can't translate that person-centered care as much as you would like because of, staffing issues, complex things that are happening immediately. Just things like we've run into now with the pandemic, where all of a sudden some we've stepped back a bit from our involving families as visitors, for an example, because of real concerns, but it's caused another real concern for families and for those patients who are not being visited. So you would say it isn't really patient-centered, that decision about limiting visiting. And so those are the types of things that happen, and I'm hoping that the framework could become like sort of I'll just call it, what we're going to use to make our decisions going forward, regardless of how difficult the situation is for us.
Thanks so much, Linda. Much appreciated. And appreciate also the fact that some of our colleagues are putting resources into the chat to share with the broader group. That's great. All teach, all learn is a fundamental philosophy of the work that we do. I think this next question, Valerie, might be for you. There's many unintended consequences of the pandemic affecting the public, and particularly socioeconomic determinants of health. Needs consideration in all of our discussions, and I know that's something that's close to your heart. So I wonder if you want to weigh in on that one.
I absolutely agree with that, and I do think that when I say public health, I'm talking more broadly than vaccines. I do think that in the context of this pandemic, we have seen investments on a number of fronts. We have connected health investments with economic investments, with housing investments, with family violence investments in the charitable philanthropic sector, because it has been recognized that people will become more vulnerable to the particular negative health impacts of the pandemic unless they are not supported in other areas of their lives. I do think that the framework, when we talk about appropriate care, for example, or even people-centered care, there is a recognition there that you try to, and completely acknowledging the challenges that Linda's mentioned around the difficulties with respect to shortages of resources and workload and everything else. It is not easy to try to customize an approach to care for each person that walks through the door, and also ensure that you're providing those wraparound supports for those individuals and the families to essentially prevent further health risks and also address the risks to which they're currently exposed. It's not an easy thing to do, but again, the framework has an aspirational component to it. I do think that we have to have that goal about being able to have better intersectoral coordination within our public services. I think Canada is committed to that. The principles that are the foundation of the Canadian health system definitely are committed to that. And I think that if we can find a way to break through some of the administrative resource type barriers and work towards those goals, we can do it. I live in Quebec, where there is a much stronger connection around health and social services than maybe in other pockets of the country. In First Nations communities, as an example, they have connected health and social services. They're working on a governance project to take over from the federal government all health and social services. There's a reason why they're making that connection. And First Nations have built health clinics in schools. They have made those types of connections. And I think there's a lot of those best practices across municipalities in Canada as well that we can draw from.
Fantastic, Michelina. And Leslie, maybe I can turn this over to you, but with a little addition that draws another question into this. As Valerie said, there's an aspirational aspect to the framework. And there's also been some questions about how do we measure our development according to those aspirations. So maybe you can combine this last question with moving into that one.
Terrific, thank you. Wanted to pick up the value already that we're seeing with the framework of informing the priorities of our various organizations. And, we have, we're really pleased as the various pan-Canadian health organizations funded by the Government of Canada, Health Canada, are joining to say this framework is going to help inform their work and priority settings. And certainly Jennifer and I and our organizations have made that pledge. And specifically seeing as an example, integrated care is one of the platforms of in the framework that is really, really key. And Valerie was speaking to the importance of that and of connecting kind of the journey as connecting the various components of the sector. And as an example, with the guidance that's there for helping to drive integrated care, which we know is a journey that people are on. We're not there yet, but the framework will draw us toward what are the questions that need to be addressed if you're a policymaker, a provider, a patient and family member. And an example of a very concrete tool and resource to support that, of which there are others, is Health Standards Organization. We're releasing Canada's first national standard of Canada on integrated care that will be released at the end of this year, so that provides further levels of specificity of what does this look like. If you take the elements of the framework, you're actually going to see some of the very key components in the standard that are kind of tied together. And that's a good example of kind of how some of this is coming together. I wanted to just very quickly as well, with the education components, building on what was said earlier, that some people may not be aware, but Accreditation Canada also, in addition to our health services accreditation, we are responsible for accrediting the education programs of 15 different professions. So medical technologists, lab technologists, paramedics, and the education programs. And so we are actually, as part of this, will be looking at how the framework helps inform, ensuring that the standards and then ultimately the assessments of how is that program for paramedics, for lab technologists, is that preparing people with the kind of content and competencies that are essential to be in place as to support our future providers working in ways that reflect the framework. So that's another example of kind of concrete how we're putting it to use. How will we measure? How will we know whether or not the framework is helping us actually achieve outcomes that we intend? There'll be a variety of steps. One, there's been work by the advisory committee on indicators that are tied to each of the 5 areas, the 5 goals. And I think the challenge for us, and certainly for Jennifer and I as we continue to steward the adoption and the use with all of you of this, is helping to channel. We've identified some priority indicators, but working with our partners so that we are able to say, okay, let's go deep and really understanding kind of how we're going to measure and monitor this, and getting some consensus and building ways to feed back on those. We know that's a real challenge in Canada. Everybody's got their own ways of reporting and different ways to do things. But one other small example of how we will kind of try and move that in a concrete way is one of the things that virtually probably almost all of you who are on the call, and maybe and certainly many others, go through the accreditation process with Accreditation Canada. This framework is going to inform the update of the quality framework and the update of our programs, the priorities of the required organizational practices and updates to standards, as well as updates on the requirements of evidence to support the implementation of safety practices that tie to the framework. So we'll be doing also work that will then try and connect in a concrete way the way in which organizations going through the accreditation process are on a more continuous basis as opposed to an every 4 years, but the way that data gets captured, shared, benchmarked, that would also make sure that we're doing that in a way that is reflecting the framework. So we're helping to build and continue to add to the knowledge and the insights that can be gained. And that's just, those are kind of some examples of the ways in which we will work as we go through the asking for and seeking the endorsement of each of the provinces. As we said, we met with the deputy ministers, all the federal and provincial deputy ministers, and we're continuing to try and lock in that commitment that will then help put this to use so that we can learn through the implementation and generate the data and the insights that will help us understand where we're making progress and where we need to continue to work. A big emphasis is with, as Jennifer said, this is still it's a live framework. There's a lot of very, very good work that's going on, like the work that was on the hospital harm index and those kinds of really important ways to inform ongoing improvement. Our goal now is to try and bring some of those pieces together even more tightly so that we can learn and act on the opportunities for improvement in ways that maybe are faster and smarter and more consistent in our ability to apply learnings and continue to make a difference.
That's great, Leslie. And thank you also for touching on a number of the other questions that came in related to things like how would this be related to standards development going forward? How do we reach not just the converted but broader groups across the country? And how might it inform resource allocation decisions and other resources? So appreciate that. And now we're into our speed round. So I did warn panelists when we did our prep in the beginning that we would ask them at the end to leave us with one key takeaway. And since we started west to east in the beginning, we'll switch that up. And Nicolina, start with you so you have a chance to go first. So key takeaway.
So my key takeaway is when policymakers, boards, health leaders, health teams, and the public align their efforts on a safety issue with sustained and clear direction and guidance, I can honestly say that I could feel and sense the culture of safety that changed within the organization within weeks, which is often difficult to say. Here goes the theoretical to the practical on the ground. But somebody who was in the offices and now is on the front line to see this happening, it was hopeful, and I can see this being opportunity.
Fantastic. Thank you. Valerie, key takeaway.
I think the framework is an important tool for us to be able to have a more inclusive health system, one that will truly respond to the diverse needs that we have across Canada. I think that we have an opportunity to bring in culture and language and land and a person's whole well-being into the health system to achieve much more equitable outcomes than what we're currently seeing. If we do not address the needs of those most in need, we cannot sustain the Canadian healthcare system. Thank you. Well, Alan.
Thank you so much, Valerie. Linda.
Yes, you know what, I think that the framework is very relevant and appropriate for the public to understand and easy for them to understand. And what I would like to see is the same thing that happened with the 5 questions to ask, that over 200 organizations embraced it and it's been translated into 100 languages. I would like to see that same thing happen with our framework. And I think that with the right exposure, that can start to happen. I think the public can really help us in terms of moving forward with the implementation of the framework at all levels within our healthcare system.
Thanks so much, Linda, and thank you all for ending us on notes of hope and ideas for going forward. And certainly from the perspective of our amalgamated organization, the framework will be really helpful input as we look to develop our strategy, our brand new strategy for the brand new amalgamated organization going forward. So with that, a big thank you to all of our panelists today. Thank you to all of those who participated. And Leslie, over to you to close us out.
Thank you very much. I think the final kind of slide, Nilly, is really the call to action. You heard it so eloquently from all the panelists that have participated today. What's our ask of each of you? Please take the time again, and maybe after you've heard all of this, read the goals, look at the objectives and the outcomes. There are action guides, and you can make them, they're tailored specifically for you, for your role in the system, because we know this is taking all of us in order to bring this to life, to actually to move forward. We encourage you to look and have conversations in your own teams about the indicators for looking at, well, how can you make this real within your own areas? We encourage you to access the resources that are there to help bring this framework to life. But what we would like you to know most is that please know you can count on organizations and certainly the continued stewardship of this with the new Amalco, with Jennifer, and with myself from HSO and Accreditation Canada. You can count on us continuing to work with partners to make sure that this is not an add-on, that this helps kind of frame up, and we want to continue to work to simplify, to streamline, to make it easy for you, whatever role you play, to bring everyday excellence, everyday quality and safety to life, and that can be accessible. I love the way and the language Valerie talks about of how this can help broaden the inclusivity and equity within the system. This is a practical tool, but know that we're with you, and we'll continue to work and learn with you to ensure that everything that we do, and certainly that's my pledge as from a health standards organization and Accreditation Canada, that we'll do is to make sure that we're aligning and supporting you and bringing this to life in all of our work. And we know that that's the commitment that we are working with other pan-Canadian health organizations, other partners, and we look forward to continuing conversations, continuing the learning. I do want to take this opportunity, not only thanking everyone who has joined us today, but acknowledging the amazing work that has been done through all members of the advisory committee. It has been an absolute privilege. Very, very impressed and proud of the work that's been done to date. Now let the real hard work begin, which is bringing this to life in every day. So together we can really improve the quality and patient safety for all Canadians. Thank you for joining today. Bye for now.